Good morning, everybody. My name is Yelena Resnick, and I'm a physical therapist. And today I'm going to be covering the topic of acute disc bulging or disc herniation. In a lot of cases, we treat both conditions the same. It depends on the severity of the problem. This is the first time in my life I ended up with what I think disc bulging. It happened 2 days ago, and I've been treating a lot of people for this condition, but it never happened to me. So now I'm checking if my practical, theoretical knowledge and the practical can be applied, and what's the best way to deal with the problem since I have it, so I know how you guys feel. I can explain to you. Basically, we're going to go step by step what you do when you have a sharp pain in your back. I'm not going to be using medical terminology in this video, not because I don't know it. I want you guys to, this is video for just the average person who's not in the medical field. So I need you to understand what's going on with your back, because this is very painful, frustrating. You can't work, disabling, horrible. And now I know how it feels. So it happened 2 days ago. I just leaned to put my dishes into the dishwasher, and I couldn't, straighten up because I had such a severe pain in my back. So discal problems can happen in two cases. Either it's traumatic event, you lifted up something heavy or caught somebody who was falling, you were not ready for it, a traumatic, like car accident, something like this. Or in my case, when you're a busy mom and you have a back pain, like little bells, and you keep ignoring it and ignoring it and ignoring it, and then eventually you end up with a discal problem like I did. Either way, the treatment that I'm going to show you today, it's a step-by-step instruction of what I was doing. So let's just go over the difference between disc protrusion, or sometimes people call it as a bulging disc, and disc herniation. The treatment is the same, again, depending on the severity of the situation. If it just happened, my best advice would be no heating modalities. Use the ice pack, apply it, put it to your lower back or the part of your back that is hurting. Call your doctor, ask for the pain medications, because I can't really advise any. I'm a physical therapist. So it's better to call your doctor and ask what kind of pain medications you can have depending on your medical history. And this, number 3, use the lumbar support belt. Just tie it around your body and use that. When you go to sleep, you can take it off, but wear it during the day. So that would be pretty much day 1. So number 1, ice. You can ice it every 2 hours for 8 to 10 minutes. Apply it to the area that hurts. Use the lumbar belt, lumbar support belt. You can get it in any store. You can get it on Amazon. You can get it everywhere. And pain medication, the pain management, and rest. You can't really go to work, which I made a mistake. I did, and I barely made home. Because once it's happened, you feel really bad, but then in 2, 3, 4 hours by the evening, it can get progressively worse. So I'm going to repeat myself: medication, pain medication, rest, ice, and the belt. That's day 1. So let's just go over what is happening to your back, because sometimes people don't know what's going on. So again, it's not life-threatening. It's going to go away. It's going to heal, but you then have to just take care of your back, do some strengthening exercises, so on and so on. So again, I'm an old-fashioned way. I'm not a computer wizard. So I'm gonna. This is my drawing. I did my best. This is what we call disc protrusion. People usually call it a bulging disc. So you see the picture, level 1, right on top. This is how it looks normal, and you have nerve roots. The yellow is your discs in between the vertebrae. Nothing is happening with the vertebrae. So I need you to understand that your vertebrae are there, not going anywhere. So between the vertebrae, there is a disc. So picture on the top, you see the normal disc, and the second level of the disc, you see the bulging. There's also bulging can go to either side, left or right. Even it can go forward and back, but in most cases it goes left or right. Depending on what side you have a disc bulge or protrusion, you have a nerve root compression, and that what causes the pain and all the symptoms on The symptoms also depends on the level of the bulging. More higher levels, let's talk about the lumbar spine. If we're talking about the lower back or the lumbar spine, how we call it, the upper levels, you may feel more pain on the anterior thigh or on the side of the thigh. See, I keep using the language, the medical language, or on the side of the thigh. If you have a bulging disc, like all the way at the bottom, you would see on this picture, it went to the other side. You will feel pain in the back of your leg going into your great toe. So again, the pain, it's what we call radiating pain, but the origin of the problem in your lower back. Let's move to the next picture. This is the herniated disc. See the difference? This is just a bulging, and this is the herniation. Herniation meaning that we do have a little liquid inside the disc that is between the vertebrae. Again, nothing is happening to the vertebrae. They're not leaking, breaking, or anything. This is the herniated disc. You do have some liquid in there that kind of comes out from the torn disc. And the liquid is more like a toothpaste type of material. I'm just trying to explain it more precisely. And it compresses the nerve root even more, causing even more severe symptoms. So the bottom one is a severe herniation and usually requires surgical intervention, where they remove the yellow disc, they remove the yellow part of it, and then they fuse two vertebrae together surgically to decompress the nerve root. Because the bottom herniation is very severe, it can cause the numbness of the leg, and then it can cause the weakness of the leg. You're losing the muscles, mass, so on and so on. So we don't need that. All right, so let's go back to me. So in my case, I would assume I have somewhat like level 2. If you look from the top to bottom, so probably bulging, like I would say from mild to moderate, but it's causing a lot of pain and drama in my life right now. So next what I'm going to show you is what exercises to do. You start doing those exercises day 2 and day 3, and then you're going to feel progressively better. When you go to sleep, better position on the stomach. In my case, I couldn't do the whole night on the stomach. It was hurting a lot. I was tossing and turning. So in my case, for me, it was easier to sleep either on my back or on the side with a pillow between my legs. That would work for me, just a suggestion. All right, I will see you in the next video. I need to get ready, so I'm gonna show you what to do, what exercises to do, how to move on the second day of your discal problem. See you soon. All right, this is the second part of my video. As I said, you would need to wear the lumbar support belt. Let me show you how you do it. So when you put it on your back, you're putting it on a lower portion, not like this. Remember, we're not wearing the corset. We don't need that. Gotta go on the lower portion, like that. All right, you make sure it's tight. If you need to tighten more, so see how low it is. So you gotta put it on your lower back. If we're talking about the lower back discal problem, like in my case. All right, this is day 2. Once it happened, you may feel like your body is shifted. So in my case, it's on the right side. So I had a little more shift. It's called the lateral shift, or you would feel yourself, like your upper body shifts to one side. The greater the shift, the greater the problem. Usually body shifts away from the painful side. It's a kind of protective reaction of your body. So if you see the shift, it's most likely the discogenic problem in your lower back. So in my case, again, it's on the right side. So I'm better now, more aligned today, but I still feel like I'm a little shifted to the left side. So these are the exercises you're gonna do the day 2. Make sure when you lower yourself down, gonna go on your knees first. All right. Then you're gonna slowly go down on your tummy. Okay? So this is what I need you to do. Once you go down, I need you to relax and stay in this position for some time. Just let your body relax and your spine to realign a little bit, get used to being on the floor. different surface. And then if you have a lot of pain, so you start with just doing this, getting on your elbow. Make sure you don't lift your head up, like keep it, you know, straight. And stand on your elbow, count to 10, and then you go down. This is how I started. Then you go up again on your elbow. Make sure your legs are relaxed. Okay, not like this. We're not doing push-ups, remember? So it's relaxed. So you go on your elbows. So you do those for maybe a couple of minutes, and then you're gonna stand up, go about your business, and then you need to get to the floor in about 2-3 hours and do that again. Okay, then you go down. So in my case, I feel a little bit better, so I can go a little more back, like this. I can't go all the way up, it still hurts. And down. Gotta breathe in when you go up. Breathe out when you go down. Two, so you do it 10 times. So by doing this, we're kind of pushing the disc from the nerve, pushing the disc away from the nerve. All right. So once you did it 10 times, this is the way you get up. So you're gonna go in your hands and knees, really slow. So it's not like I'm mimicking the patient. I am the patient right now. My back is killing me. That's why I decided to record this video so you guys see exactly what you do. Once you get straight, you put one leg up so you can lean on the leg. Push yourself up, and then slowly you're gonna straighten yourself up like this. All right, this is what you do. Please do that every 2 to 3 hours. This is day 2 of the discal problem, and you should start feeling better by the midday today. Use ice pack, put it on the, don't be afraid, because people are asking me what's going to happen with my kidney. Nothing's going to happen with your kidney. You know, just put the ice pack for 8 to 10 minutes on the area that hurts. In my case, it's right in this area. And you can do it 2-3 times a day. I mean, if you do have any kidney problems, like speak to your doctor. You gotta use your logic. You know, you're watching this video, but again, you have to understand and use your logic that one video does not apply to every single case. This is just what worked for me, and I'm sharing it with you. So if you need to pick something up, well, no bending, no heavy lifting, no twisting. This is how you move. This is how you move. You move like one unit, like one piece. If you need to lift something from the floor, you're giving the chance for your back to heal. Let's say you need to pick up something from the floor, when like really need to pick something from the floor, not like cleaning or anything. So this is see what I did? You gotta squat, pick it up, and go up again. This is how you do it. You don't bend, you don't twist. If it's on the side, then you position yourself and you do this. Pick it up and you go up. But this is another suggestion. If you're walking, you see something on the floor, this is what you do. This is another way. This is what I do. You see something on the floor, you do this. And you keep walking, because your back is much more important than the stuff on the floor. All right, good luck to you, and I hope you're gonna feel better soon. Just, if you like my video, put likes, follow me on my YouTube channel. You're gonna see a lot of useful stuff in there. All right, thank you very much. Bye-bye, everybody.